Health experts have called for urgent placement of critical vaccine-related expenditures on first-line charge status, stressing that preventable childhood deaths and worsening maternal mortality cannot wait on bureaucratic budget releases. They decried a continued delay in the release of 108 billion naira immunization funds earmarked for 2024, warning that the backlog threatens to reverse Nigeria's already fragile public health progress. The experts emphasized that vaccine funding is an investment, not an expenditure, citing the high economic and emotional cost of managing disease outbreaks such as polio, diphtheria, yellow fever, and cholera, all of which are preventable through immunization.
Is that our major concern, and that is where our problem is, the issue of priority. Do the government, it is wanted to release, do they actually have oversight function to see that what is being released is being utilized for the purpose?
In 2024, we still have an outstanding of 108 billion naira. That's the call to action. If immunization were prioritized, that wouldn't happen. That payment would have been made. But even if the government pays today, it is paid in arrears. Nobody knows how many children would have died.
So we now want the state private healthcare boards that are responsible for vaccination in this country to intentionally review the National Health Act for basket funding. So all these partners, development partners, everybody that is doing this, so create primary healthcare fund that every partner will put in. So we have about 4 different sources of funding for primary healthcare and immunization in every state.
Over the last few years, immunization efforts have, 1, expanded the routine vaccination coverage, 2, introduce new life-saving vaccines, including HPV, rotavirus vaccine, PCV vaccine, and many other vaccines.
We are not only speaking loud on vaccines, I mean the administration, the funding for vaccines. We're also speaking on domestic production of vaccines.
If you have to make a choice, choose immunization, because the return on investment, a $1 investment in immunization gives a $44 rate of return.